Good morning, ladies. Dr. James Whittaker here. And today we need to have one of the most important conversations that most doctors actively avoid having with their female patients over 60. This isn't about a specific disease or condition. This is about a fundamental shift happening in healthcare that affects every woman in her later decades. And if you don't understand what's really going on, you'll wake up one day wondering why your health declined so rapidly and why no one warned you it was coming. Before we dive into this critical information, I have an important question for you. Where are you watching from right now? Take a moment and drop the name of your city or country in the comments below. I want to see our community of wise, experienced women from across the world making their presence felt, because this message truly matters to every single one of you. And if you believe that women deserve to know the real truth about what's happening in healthcare as we age, not the sanitized version most doctors provide, then hit that subscribe button right now and turn on notifications. If you're new to this channel, welcome. I'm a board-certified physician who spent over 2 decades helping patients navigate health challenges, and I create these videos to give you the information that too many doctors don't have time to explain properly in their rushed appointment slots. Now let's talk about something that's been concerning me for years as a physician who genuinely cares about his patients' well-being. There's a quiet shift rippling through healthcare, a fundamental change that isn't making headlines or being discussed openly in medical conferences. Yet you feel it, don't you? That persistent, unsettling feeling that something has changed in how doctors treat older women. The world of healthcare you once knew, the one that seemed to operate with genuine concern for your well-being and quality of life, that comfortable relationship where your doctor actually listened, it's fading away. And here's what concerns me most. Most women over 60, despite being highly observant and intuitive, haven't fully grasped that this transformation is happening right in front of them. This brings us to the first hidden truth, and I need you to really hear this. The healthcare system you've learned to trust over decades is no longer built primarily with your best interests and quality of life at heart. Instead, it's being quietly redesigned with different priorities. Priorities that don't necessarily align with helping you maintain vitality, independence, and well-being in your later years. I'm not talking about conspiracy theories or dramatic accusations. I'm talking about a deliberate shift in how healthcare approaches aging women, a shift in the underlying philosophy from "let's keep you healthy and vital as long as possible" to "let's manage your conditions and accept decline as inevitable." You've noticed these changes in your own healthcare experiences, haven't you? The way your doctor appointments have become shorter and more rushed. The way your concerns are often dismissed with, "that's just part of getting older," without real investigation. The way prescriptions are handed out quickly rather than spending time to understand root causes. Let me know in the comments below what country you're watching from. I'm always fascinated to see how women from different cultures experience these healthcare challenges. Your comments help me understand how to serve this global community better. Customer service in healthcare now often means navigating automated phone systems that seem designed to frustrate you. Your medical records are scattered across different digital platforms that don't communicate with each other. Your appointments feel transactional rather than relational. This isn't progress in healthcare. It's a growing distance between patients and the systems designed to care for them. And this isn't random or accidental. This is a deliberate restructuring, because when patients become fully reliant on centralized impersonal systems, they naturally stop advocating loudly for themselves. They stop questioning. They accept whatever care they're offered. And when we cease to advocate for ourselves, when we become passive recipients rather than active participants in our healthcare, we become easier to manage, more predictable, and ultimately quieter about declining quality of care. This shift is precisely why so many women over 60 today report feeling invisible in healthcare settings, feeling unheard when they express concerns, feeling like their quality of life doesn't matter as much as it should. It's not your imagination. The priorities have genuinely shifted. Now ask yourself this profound question. If the healthcare system can make the generation of women who've raised families, built communities, and contributed enormously to society feel like their health concerns don't warrant thorough investigation, simply because they're over 60. What does that say about where we're headed? That's the first truth. The system no longer actively prioritizes your vitality and well-being the way it once did. It prioritizes efficiency and cost management. Yet here's what gives me hope, and I want you to hear this clearly. You still have time. Not endless time perhaps, but enough time right now to wake up, to understand what's happening, to become an informed advocate for your own health, and to navigate this changing system successfully. And I promise you, by the end of this message, I will show you exactly how to do that. Because the final truth I'll share will reveal what's coming next in healthcare and precisely what actions you can take right now to protect yourself and ensure you get the quality care you deserve. So please stay with me. The next truth will build directly on this foundation, and it will explain why this growing distance between patients and quality care is spreading faster than ever before. Before we go deeper, I want you to consider something. When was the last time you took even one dedicated day to truly plan out your health priorities for the next decade? To honestly review your daily habits, your health goals, your concerns, and what you want your life to look like in your 70s and 80s? That's why I consistently advise people, especially those in their 50s, 60s, 70s, and beyond, to use tools that bring clarity and intention to their health journey. Because when the healthcare world around you is changing rapidly and becoming more impersonal, clarity about your own priorities becomes your greatest shield and protection. You may not be able to control how the healthcare system operates, but you can absolutely strengthen your own health literacy, your self-advocacy skills, and your ability to navigate the system effectively. So write this down somewhere prominent. Preparation is protection. That's not just a saying, it's a literal survival strategy in modern healthcare. Now here's a powerful question you should ask yourself tonight, perhaps right before you go to sleep. If the healthcare system became even less accessible tomorrow, if appointments became harder to get, if doctors had even less time to listen, how ready am I right now to advocate for myself and navigate these challenges? That single question separates those who will maintain their health and get quality care from those who will be swept along, passively accepting whatever they're offered. As you ponder that thought, I want you to engage in the comments section. Write, "I choose to stay informed," or "I'm ready to advocate for myself." Pick the phrase that resonates with you, because by the time we reach the final truth, you'll understand exactly why that choice matters so profoundly. Stay right here. The next truth reveals why older patients, particularly women, are being quietly deprioritized in healthcare and how this shift is reshaping the care you receive. And what I'm about to say will illuminate many of the frustrating experiences you've had in doctors' offices lately. If you felt a chill of recognition when listening to what I shared earlier, that wasn't fear or paranoia. That was your intuition knowing that what I'm describing is true. You've experienced it yourself in small ways that accumulate. Those moments where it feels like doctors aren't really listening anymore. Times when your concerns don't seem to carry the weight they once did. Instances where you're made to feel like you're overreacting or being too demanding simply for asking questions. That brings us to the second hidden truth, and this explains so much of what you're experiencing. Silence has become the new form of control in healthcare. The system no longer needs to explicitly deny you care or tell you to go away. Instead, it achieves control through something much more subtle: systematic dismissal and normalization. Everything you experience after 60 gets attributed to normal aging rather than investigated as potentially treatable or preventable. You've likely observed how meaningful conversations with doctors have largely disappeared. Now every appointment is dominated by the doctor typing into a computer, asking standardized questions from a checklist, and rushing to the next patient. Deep listening has been replaced by efficiency metrics. This is not coincidence. It's a deliberate pattern driven by how healthcare systems now measure and reward doctors. Because when your concerns are consistently dismissed as just part of aging, you eventually stop bringing them up. You stop asking for investigations. You stop demanding answers. You become a quieter, more compliant patient. And women over 60 who remember when healthcare was more personal, when doctors actually took time to listen and investigate thoroughly, represent a challenge to this new efficiency-driven model. Your generation remembers what good healthcare looked like. You remember doctors who knew your family, who took time to understand your concerns, who investigated thoroughly before prescribing. That memory is dangerous to a system that's trying to process more patients in less time with fewer resources. That's why your voice isn't being amplified anymore. It's why your concerns are being minimized. Not because they don't matter, but because addressing them properly takes time and resources that the system is no longer willing to invest. The system wants patients who accept quick answers, who don't ask too many questions, who comply with standardized protocols without demanding personalized attention. It wants patients who don't remind others that healthcare used to be different and could be better. Let me ask you honestly, when was the last time a doctor asked about your quality of life goals for the next 10 years? When was the last time someone in healthcare truly listened when you spoke about what matters to you, what you're afraid of losing, what you hope to maintain? I want you to answer in the comments right now. Don't hold back. Write, "It's been too long," or "Never actually," or "I'm ready to demand better." Your words will remind countless others that they're not alone in feeling unheard. Listen carefully. This dismissal isn't just emotional, it's structural and systematic. Every major healthcare system is now optimized for volume and efficiency, not for thoughtful, personalized care. The metrics that determine doctor compensation don't reward spending time listening to older patients. They reward seeing more patients in less time. The algorithms that schedule appointments don't account for complex cases that need more discussion. They maximize throughput. And in a system engineered for speed and volume, whose voices get lost first? The voices that require time to fully explain their concerns. The voices that need thorough investigation rather than quick prescriptions. The voices that demand to be heard and understood. This is why so many women over 60 feel invisible in healthcare settings. But here's what I want you to understand. That feeling is based on a systematic reality, not on your personal failings or excessive demands. Your silence has been engineered through consistent dismissal. Let me share a concrete example from my own practice. Last month, a 72-year-old patient named Margaret came to see me after becoming increasingly frustrated with her primary care doctor. She'd been reporting progressive fatigue, difficulty concentrating, and unexplained weight gain for over a year. Each time she brought these concerns to her doctor, she was told, "You're 72. This is a normal aging. Maybe you're a bit depressed. Here's an antidepressant." No one had bothered to check her thyroid function, her vitamin levels, her hormones, or her metabolic markers. When I actually investigated with comprehensive testing, we found significantly underactive thyroid, severe vitamin D deficiency, B12 deficiency, and early insulin resistance. All completely treatable conditions that had been dismissed as normal aging without any investigation whatsoever. Within 2 months of proper treatment, Margaret felt like herself again. Her energy returned, her mind cleared, and she lost 15 pounds without trying. In that moment, she realized something disturbing. Dismissal has become the default response to older patients' concerns. But here's what the system didn't anticipate. They didn't expect wise, experienced women like you to wake up and start questioning this dismissal. They didn't foresee the generation that built so much beginning to demand the quality care they deserve. So I want you to remember this. When you start speaking up again, when you refuse to accept dismissal, the systematic silence begins to crumble. Never underestimate the power you have when you become an informed, vocal advocate for your own health. Start small if you need to. Call someone today, a friend or family member, and share something you've learned about health that you wish you'd known sooner. Write it down. Make notes of your symptoms and concerns before appointments. Track patterns. Because silence only wins when you stop sharing. Stop advocating, stop demanding better. Now I want to offer you something practical. Remember how I mentioned planning and preparation? This is where it becomes crucial. Use whatever works for you, a notebook, a planner, an app, to track your health systematically. Document your symptoms, your energy levels, your concerns. Write down questions before appointments. Keep records of what doctors tell you, because when you show up informed and documented, you're much harder to dismiss. You're forcing engagement rather than accepting quick dismissal. But let me be completely honest about why I'm emphasizing this so strongly. Time is running out. There's something coming in healthcare. Changes in how it's funded, how it's delivered, how it prioritizes patients. That will make this dismissal feel permanent and unchangeable. And before this message ends, I will show you exactly what that is. You'll understand why almost no one is talking about it openly and how it's already reshaping everything from appointment availability to treatment options. But before we get there, you need to understand one more hidden truth. A truth that explains how this dismissal is being reinforced through things that seem helpful but actually make the problem worse. It's subtle, disguised as progress and innovation, but once I reveal it, you'll see it everywhere. So don't go anywhere. Because if the first truth showed you how priorities shifted and the second truth exposed how dismissal works, the next truth will reveal the mechanism that's making it all worse. And only then will the final truth make complete sense. You've sensed it, haven't you? That feeling that healthcare is becoming less personal, less human, less responsive to your actual needs. This isn't because medicine has become more complex. It's because convenience and automation have become the priorities over genuine human care. That's the third hidden truth. Technological convenience in healthcare has become a form of control and distance. We were promised that technology would improve healthcare, make it more accessible, give us better outcomes. But what if I told you that for many older patients, it's achieving the opposite? What if every step toward convenience has actually been a step away from quality personalized care? Think about it honestly. When was the last time you made a healthcare decision without consulting the internet first? When was the last time you could simply call your doctor's office and speak to a human being who knew you? Here's the uncomfortable reality. The very technologies that promise better access are actually creating more barriers for older patients. Every patient portal that requires complex passwords and navigation replaces simple phone calls. Every telehealth visit that seems convenient actually removes the physical examination and personal connection that often reveals important information. Every automated system that routes your call replaces the receptionist who knew your name and could help you navigate the system. This isn't conspiracy. This is deliberate design prioritizing efficiency over relationships. And who benefits when patients become dependent on technologies they may struggle with? Not you, not your quality of care, the healthcare corporations that can reduce staff and increase profit margins. Older women especially, you're experiencing this shift acutely. They call it digital health access. But what it often means in practice is barriers to access for those less comfortable with technology. Your comfort with face-to-face communication, your preference for human interaction, your expectation of personal relationships with healthcare providers, all of these are being systematically replaced with screens, portals, and automated systems. Does this resonate with you? Comment below if you've felt frustrated by the increasing barriers technology creates rather than solves. Write, yes, technology has made it harder, or I miss human connection in healthcare. We were never meant to manage complex health issues through impersonal digital interfaces. We were designed for human connection, for doctors who know us, for relationships built on trust. Yet technology has wrapped everything in a supposedly convenient package that ensures you don't notice the human element disappearing until it's completely gone. That's how control spreads in modern systems, not through obvious denial, but through automation disguised as improvement. People stop demanding personal attention because they're told the technology is more efficient, more accurate, more convenient. But efficiency isn't care. Automation isn't relationship. Technology is a tool that should enhance care, not replace it. Look at what's happening in healthcare systems everywhere. In-person appointments are being replaced with telehealth that can't provide physical exams. Phone calls are being replaced with portals that many older patients struggle to navigate. Human receptionists are being replaced with automated systems that frustrate and confuse. And every time you express frustration with these changes, you're told you need to adapt, to learn the technology, to accept that this is progress. But maybe those who resist these changes are the ones who remember what quality personal health care actually looked like and refuse to accept its disappearance. Do you see the pattern? The convenience they offer comes with hidden costs. The technology that promises access actually creates barriers for many. And here's what I need you to understand. When the generation that remembers personal, relational healthcare falls silent, entire populations forget what quality care looks like and stop demanding it. This is why this matters more than anyone realizes. Because you, the generation that remembers healthcare before it became impersonal and automated, are exactly the voices they need to quiet. They don't want you teaching younger generations to expect personal attention and human connection. They want you adapting to and accepting increasingly automated, impersonal systems. But that's exactly why you must not stop speaking up, must not stop demanding human connection and personal attention in your healthcare. That's why learning to navigate new systems while also insisting on human elements is so important. Use technology where it genuinely helps, but don't accept it as a complete replacement for human care. Insist on in-person visits when they're important. Ask to speak to humans, not just automated systems. Demand that efficiency doesn't completely replace relationship. Tell me in the comments if you're doing this and how it's working. Write, I insist on human connection, or I'm learning to balance both, or I'm starting to advocate today. Now listen carefully. If the first truth revealed shifting priorities and the second truth exposed systematic dismissal, this third truth explains how technology is being used to create distance disguised as convenience. But the next truth is different. It's not just about systems or technology. It's about the ultimate direction, where all of this is leading. And most people have absolutely no idea what's truly coming. So don't miss what I'm about to share next, because the fourth truth is the most important, most urgent, most actionable of all. No one else will say it, because once you understand it, you can't unknow it. And once you comprehend what's approaching, you'll realize why time is critical to prepare, to build relationships with good doctors, to become health literate, and to protect your access to quality care. You've witnessed how healthcare priorities changed. You've observed how dismissal has become systematic. You've perceived how technology creates distance disguised as convenience. But this fourth truth is what all of these have been leading toward. This is the most important truth because once you understand it, you'll never look at healthcare the same way. Here it is, and I need you to really absorb this. The system being built is not just about efficiency or cost savings. It's about fundamentally changing the relationship between patients and healthcare, shifting power and control completely away from you. It's not just about making appointments harder or doctors busier. It's about systematically removing your agency, your voice, your ability to demand and receive quality personalized care. Everything that's been implemented, from how your data is controlled to how your access is managed, from how your concerns are dismissed to how technology creates barriers, has been building toward one outcome: a healthcare system where you are a passive recipient of whatever care algorithms and administrators decide you should receive, not an active participant with agency and voice. The goal isn't just to make healthcare more efficient. It's to remove your expectation of personalized, thoughtful, relationship-based care. Because when patients stop expecting quality care, stop demanding human connection, stop insisting on being heard, they accept whatever limited care they're offered without complaint. This is happening now, right now, across healthcare systems. They're merging corporate control, technological barriers, time pressures, and systematic dismissal into one approach that promises efficiency but delivers depersonalization and loss of patient agency. But this efficiency comes at an enormous cost: the loss of healthcare as a human, caring relationship. I want to ask you something personal. When was the last time you truly felt like a partner in your healthcare? Like your voice mattered? Like decisions were made with you rather than for you? When was the last time a healthcare provider made you feel like your concerns and preferences were the top priority? Drop your answer in the comments. Let's be honest with ourselves. Write, I still feel heard, or I've lost that feeling, or I want to reclaim my voice. Here's the truth. Women like you are the last generation that clearly remembers healthcare as a caring relationship, not just a transactional service. You remember doctors who knew your family, who took time, who treated you as a whole person. That memory is your power, and that's exactly what the system needs to erase. Have you noticed how everything that once supported patient agency is being quietly removed? Your ability to easily reach your doctor is disappearing behind phone trees and portals. Your time with doctors is shrinking to the point where there's no space for real conversation. Your medical records are controlled by corporations, not by you. Your treatment decisions are increasingly guided by protocols and insurance approvals, not by you and your doctor together. Even your ability to question and advocate is being diminished by systematic dismissal and time pressure. Yet here's what no one will say aloud. This isn't just about healthcare efficiency. It's about replacing patients who actively participate, question, and demand quality care with patients who passively accept whatever they're offered. If they can make you feel powerless, if they can convince you that you have no voice, then they can completely control your healthcare experience and your expectations. That's why this message had to reach you now. Because time is running out to build relationships with healthcare providers who still practice personal, patient-centered care, to become so health literate that you can effectively advocate despite the barriers, to connect with communities of patients who support each other in navigating this changing system, and to protect your agency and voice while you still can. Do you feel it? That sense that something fundamental is shifting? That's not fear. That's awareness trying to wake you up. This is why I emphasize preparation and education so strongly, not just to organize your healthcare, but to reclaim your agency, to refuse to be a passive recipient, to insist on being heard and respected. Each time you speak up, each time you insist on being heard, each time you refuse quick dismissal and demand thorough investigation, you're fighting back against this systematic removal of patient agency. Because what's coming next, most people aren't prepared for. They're unprepared for healthcare where algorithms decide their care, where their voice matters less and less, where efficiency trumps everything. But you can prepare. Here's what happens if people continue accepting this passively. They'll wake up one day and realize they've lost all agency, all voice, all partnership in their healthcare. They'll be passive recipients of whatever care distant administrators and algorithms decide they should receive. And they'll wonder when this happened, never realizing it was a gradual process they could have resisted. But you're different. You're aware now. You've heard what others won't say. You've seen the patterns. This truth matters because you still have time to act, but that window is closing. Prepare by finding doctors who still practice personal care. Build your health literacy so you can advocate effectively. Document everything so you can't be easily dismissed. Connect with other women navigating this. Teach younger women to expect and demand better before they accept depersonalized care as normal. Because the darkest truth isn't that bad healthcare is coming, it's that depersonalized, algorithm-driven healthcare is already here. But light always breaks through when people wake up and refuse to accept it. That's why this message found you. Not randomly, but exactly when you needed it. You were meant to hear this. You were chosen by your own awareness to see what others still miss. And now you have the responsibility to share this with others who need it. Before we end, do one important thing. Like this video so it reaches more women who need to hear this truth. Subscribe with notifications on because in my next video, I'll reveal exactly what specific changes are coming and precisely how to navigate them successfully. No one else will tell you the unfiltered truth about where healthcare is heading, but I will because you and every woman like you deserve to know and deserve to maintain your voice and agency in your healthcare. Check my playlist for more content about navigating modern healthcare successfully, and I'll see you in the next video where we continue fighting for your right to quality, personal, respectful healthcare. Take care.